Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with lung and respiratory ailments that start with the letter P1. First part. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address the issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and then specific to men, then issues of the hormones and the metabolism. Then after that, I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems of infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk, for example, of phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, natrum-beer people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings, and an account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with lung and respiratory ailments. Today, we will continue with lung and respiratory ailments that begin with the letter P, first part. Gaseous exchange takes place in tiny cul-de-sacs in the lungs called alveoli. These have in the adult human lung a combined surface area of about 750 square feet, roughly the size of a tennis court. Blood laden with carbon dioxide is pumped from the heart to the lungs through the pulmonary arteries. Oxygen-rich blood returns to the heart through the pulmonary veins. Connecting these arteries and veins are many millions of alveoli, each supplied with thousands of blood capillaries, constantly exchanging carbon dioxide for oxygen. The lungs are twin conical structures, one on each side of the heart. They are enclosed in a double membrane, the pleural membrane, which is filled with fluid to allow friction-free movement inside the rib cage. The diaphragm, the dome of muscle primarily responsible for breathing movements, lies directly beneath the heart and lungs. Each lung is a mass of branching airways that becomes narrower and narrower as they approach the alveoli. The walls of these airways produce mucus to keep the internal environment of the lungs moist. They are also lined with tiny hairs that beat together like wheat in the wind, trapping dust and other foreign particles and ferrying them out of the lungs so that they can be expelled by coughing or sneezing. Nicotine paralyzes this extremely efficient garbage removal system, resulting in smoker's cough. Foreign particles that remain in the lungs, and of course any opportune viruses or bacteria, cause local inflammation and excessive production of mucus. If many small airways become blocked and many clusters of alveoli become flooded with mucus, respiration deteriorates. In bronchitis and pneumonia, the lungs are partially suffocated by their own secretions. We breathe in and out because the air pressure inside our lungs is constantly changing in relation to the air pressure outside. As we inhale, the diaphragm contracts and descends, and the rib cage rises and expands. This decreased pressure inside the lungs, and so air rushes in. As we exhale, the diaphragm rises and the ribs fall, pulled down by gravity. This increased pressure inside the lungs, and so air rushes out. Although we can control the rate and depth of our breathing, we cannot voluntarily stop breathing. Hiccups. Hiccups are a sudden contraction of the diaphragm, causing a sudden rush of air into the lungs, which in turn causes the vocal cords to snap shut with a kick. It is probably caused by a purely mechanical irritation of the diaphragm, by laughing, being tickled, or too much air in the stomach, which lies directly beneath it. Specific remedies, to be taken every 15 minutes for up to 6 doses. Doses may be easier to take if you crush the pilule between 2 clean spoons. Dissolve it in a little warm water and sip. For hiccups that are accompanied by belching and retching, especially if they come on an hour or two after eating a very large and very rich meal, use Nux 6C. For hiccups that come on after eating or drinking, after smoking, or after an emotional upset, use Ignatia 6C. For violent, noisy hiccups with belching, use Cicuta 6C. That's Cicuta 6C. For obstinate hiccups, where the chest feels sore and with retching, use magnesium phosphate 6C. For hiccups that are better for drinking a little water, and the person has a respiratory problem, use Cyclamen 6C. For hiccups in an infant who is feeding poorly, use Aethusa 6C. For hiccups that are made worse by cold drinks, fever, and feeling chilly, use Arsenicum 6C. Self-help. Holding your breath, breathing rapidly, breathing into a paper bag, drinking cold water, and then holding your breath, pulling your tongue forward, having someone give you a shock. All of these are effective hiccup stoppers. So is squirting lemon juice down the back of your throat. A drink of water with a little sugar in it usually stops hiccups in infants. Pleurisy. Pleurisy is an inflammation of the membranes that surround the lungs, caused by infections such as pneumonia and tuberculosis, or by an injury, or by seepage of air into the space between. Inflammation causes severe chest pain, usually one-sided, and makes breathing painful if fluid accumulates in the space between the pleura. The pain abates because the membranes are no longer rubbing together, but the person may become breathless due to the pressure of the fluid on the lung. If the fluid-filled pleura become infected, the result is empyema. In addition to treating the underlying condition, possibly with antibiotics, doctors may prescribe painkillers. Specific homeopathic remedies are to follow. Specific remedies. To be given every hour for up to 10 doses during an acute attack. If there is no improvement within 12 hours, see your doctor. For pleural pain aggravated by movement but soothed by lying on the affected side, and the person is thirsty and irritable, use Bryonia 30C. For fluid pressing on the affected lung with sharp cutting pains made worse by the slightest movement, use Sulphur 6C. For dry staccato cough, sneezing, and stitching pain in the chest, and wanting to take deep breaths, use Squilla 6C. For sharp pain that comes on suddenly after exposure to cold, dry wind with breathlessness, anxiety, and a fear of dying, use Aconite 30C. For fluid in the lung that causes breathlessness and burning pains with mild fevers, and the heartbeat is rapid and irregular, and a frequent dry cough, use Cantharis 30C. For pain that comes on very suddenly, with the face flushed and hot, great thirst and delirium, use Belladonna 30C. If recovery from pleurisy is slow and complicated by fluid on the lungs, use Hepar Sulph 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.